Welcome dear doctors. Welcome to Kidscovery. I am Dr. Parv and I am your faculty of Pediatrics. Let's start with today's topic in the pediatric immunology, and the topic is Ataxia-Telangiectasia. So the name is a little bit tricky, and people, once they see this name, they're like, oh god, what a difficult topic. But if you break down these both terms now, things are going to get very easy for you. Ataxia. I think you know what is ataxia. So it's actually the main symptom is the neurological impairment. That's why there's a loss of balance and everything which is going to occur. Okay. So Ataxia-Telangiectasia means ataxia, that is poor neurological impairment which is going to be there. And telangiectasia, it's just the micro bleeds which is going to happen, or not actually the bleeds but the dilatation which happens. Okay, dilatation of the blood vessels. Okay, dilatation of the blood vessels, that is going to happen, and that is approximately how much? That's approximately 1 to 3 mm, you can remember. Okay, so that's actually the dilatation of the blood vessel. So Ataxia-Telangiectasia, starting from A for what? First thing, important thing, autosomal recessive. Okay, so Ataxia-Telangiectasia is an autosomal recessive disorder which is characterized by, as I've told you, A for ataxia. Ataxia is nothing but a progressive neurological impairment. There is going to be cerebellar ataxia also. There is going to be telangiectasia, where in the ocular as well as in the cutaneous regions. Of course, in the skin and inside the eyes. Okay, of course, on the skin and inside the eyes. So can you see this? This is in the eyes which is happening. Can you see this? This is the dilated vessels in the ear, in the skin. This is also the skin which is dilated. So this is how, and see this, these are also dilated. So oculocutaneous telangiectasias are also going to be there. But there is a reason why we are discussing it in immunology, because it is responsible for showing immunodeficiencies also. And yes, there are intellectual disabilities which are going to be there. Why? Because of the progressive neurological impairment. So very simple, ataxia means it's a progressive neurological impairment. Second is cerebellar ataxia. Telangiectasia is ocular and cutaneous telangiectasia. There are only two things which are left. One is going to be immunodeficiency and other is going to be intellectual disability, which is going to be there. Now this Ataxia-Telangiectasia is actually caused by the mutations in ATM gene, very easy to remember, ATM. Okay, and once you go to the ATM, just like you remember the pin codes, right? So this pin code is very easy to remember. This is 112223. Okay, or even if you forget 23, it's okay. So 1122. Okay, this is the pin. So pin, this is the pin code. You have to remember 11 as well as 22. 1122. Okay, 1122. This you have to remember. And similarly, if you pronounce 2 is similar to Q. So remember 1122Q. Okay, this is not P, 1122Q, 1122Q. This is how you have to remember the Ataxia-Telangiectasia. Now it has been seen that there is a immunodeficiency. Why there is a immunodeficiency? Because of lymphocytopenia. There is decreased in the lymphocytes. There is a decrease in the lymphocytes, and there is increased risk of cancer. Okay, there's increased risk of cancer. There is lymphocytopenia in Ataxia-Telangiectasia. Okay, so just remember telangiectasia. So langiec is important. So because L for lymphocyte deficiency, L for lymphocyte deficiency, and C for what? L for lymphocyte deficiency, and C for increased risk of cancer. Okay, now ataxia is actually something which is going to develop when the child is beginning to walk. And one thing which you have to understand this is that in Ataxia-Telangiectasia, of course it's a cerebellar ataxia only, but the Romberg sign is, this you have to understand. Whereas in Friedreich's ataxia, the Romberg sign is going to be positive. Friedreich's has got this R in it, so you have to remember that the Romberg sign is positive in case of Friedreich's ataxia, whereas it is going to be negative in the Ataxia-Telangiectasia. Okay, So I think Romberg sign. So what is Romberg sign? So you ask the patient to stand with the heels together. Can you see the heels are together? Yes. First with eyes open and then with eyes closed. First with eyes open and then with eyes closed. Okay. And you have to note down if there is any excessive postural swing or any loss of balance like this. Excessive postural swing or the loss of balance which is there. So if the child is having the loss of balance even when the eyes are closed or even when the eyes are open, that means the cerebellum is not functioning properly. This is called as cerebellar defect, cerebral deficit and cerebellar ataxia, which is a part of the defect in the cerebellum. Okay, which is a part of defect in the cerebellum, which is seen in what? Which is seen in the Ataxia-Telangiectasia, and that's why we say that the Romberg sign is negative, because if the eyes are open or even the eyes are closed, the patient is going to show the swing. But when will you tell that Romberg is positive? Romberg is positive when your eyes are closed. Romberg is positive when your eyes are closed. Okay, this you have to remember. Okay, so there's a concept in India. We do RCs of RCs of what? We do RCs for the car. Okay, for the vehicles there is something which is called as RC. Okay, so what is RC? Why I am telling you, RC is Romberg. Romberg, when eyes close, then you call it as it is present. Okay, and even if you can't remember this RC, leave it PCR. So what is PCR? It's a police control room. So whenever you see the police, you are going to close your eyes. So if on closure of eyes the patient is going to sway, we call it as Romberg positive. And Romberg positive is suggestive of proprioceptive defect. It is the sensory ataxia. See, now your eyes are closed. You are just maintaining your balance on the basis of sensations of the joints. I'm repeating. Now your eyes are closed and you are maintaining your balance on the basis of the sensations what you are getting. Clear? So proprioceptive defect, sensory ataxia, is going to show you the positive Romberg's test. Okay, so the Romberg's test is going to be negative in this, whereas it is positive in the Friedreich's ataxia. Okay, which is a sensory defect. Again, telangiectasia is also going to happen. T for telangiectasia, T for 3. So it is going to happen when the child is 3 to 6 years old. Yes, there is a lymphocytopenia, so you will be having recurrent pulmonary infections. Okay, there is a decreased WBC count. I have told you there is decreased IgA levels also. Okay, now there is a very close differential diagnosis. There is a very close differential diagnosis, and that is called as isolated IgA deficiency. But now the thing which you have to understand is, see, in the IgA deficiency, immunoglobulin A deficiency, there is only IgA which is decreased, whereas lymphocytes is normal. Whereas in Ataxia-Telangiectasia, your IgA is decreased and your TLC is also decreased. Why? Because your lymphocytes are also decreased. Lymphocytes are also decreased. So AT, Ataxia-Telangiectasia, this is my mnemonic to make you guys understand. Okay. What is the treatment? Of course, you have to supply immunoglobulins from outside. So give IV immunoglobulin therapy, and you have to give prophylactic antibiotics in order to prevent the infections. Now, what is the complication? In Ataxia-Telangiectasia, I have already told you that the risk of cancer is there. Telangiectasia, L for and C for. L for lymphocytopenia, C for cancer. So there is increased risk of which malignancies? Lymphoid malignancies. Why? See, the lymphocytes are decreased. This is going to send signal to your lymphocyte precursor. Okay, this is going to give the signals to the lymphocytes precursors, and these are going to proliferate uncontrollably. And once they are going to proliferate uncontrollably, this leads to the malignancies. This causes what? This causes malignancy, including the non-Hodgkin lymphoma, including the Hodgkin lymphoma, okay, and in fact the leukemias also. Okay, so this is important, very important topic, Ataxia-Telangiectasia, and a little bit insight to Romberg test I have also given to you. Okay, so this is it from my side. Thank you so much, and do reach out to us if you have any queries in this topic. Thank you.